It is an extremely common problem, impacting more than 200,000 people a year. Yet there's no cure, only treatment. So what can and should you do if you are one of those experiencing hearing loss? I'd like to welcome Dr. Carolyn Gigliotti, an audiologist with Ohio ENT and Allergy Physicians. Thanks for being here.
Thank you so much for having me.
All right, so I mentioned hearing loss is a big problem, right? How big of a concern really is it?
It is actually a very, very big concern for actually a lot of people in the U.S. It's actually the number 3 common health condition behind arthritis and heart disease. So hearing loss is a really big issue that a lot of people probably aren't as aware of, and it affects them on a daily basis. Maybe they just aren't sure how significantly.
And I feel like maybe they're not aware of it because it's something that you kind of think when you're older you get it. That's not always the case.
Yes, that's true. Not always the case. What we are finding is that people are more and more younger in age. So before we would always think it's kind of that 75-year-old and older population because we are naturally going to lose our hearing as we age. But what we're finding with the baby boomer generation is that because of everything that they've been exposed to over their lives, we're finding hearing loss sooner and earlier in life, closer now even to that 55 to 60 age range for a lot of patients.
And so what are you seeing are the causes, since it seems that more exposure is happening?
Yeah, so there's a number of causes that can cause hearing loss. There's 3 different parts of the ear, so the outer ear, the middle ear, and the inner ear. So a lot of the medical issues occur within that outer ear portion or that middle ear portion where the 3 little bones in the eardrum exist. But most of the hearing loss that people experience are nerve type of hearing loss. So that's really in the inner ear or the organ of hearing where the hair cells and the nerve endings are.
So what's the process? We know that, getting diagnosed, you probably have some kind of inkling, right? If you're not able to hear as well, but how do you go about actually getting diagnosed, getting treated?
Yeah, so most patients will come in primarily because somebody else in their family has said, hey, you're asking me to repeat, or you weren't hearing me when I was saying this, this, and this.
Right.
So a lot of times it's because somebody else is urging them to come in.
Okay.
But once they do get into the office, really what they want to do is either schedule with an ENT and one of our ear, nose, and throat physicians, and that way they can get tested if they're concerned about their hearing with one of the doctors of audiology. So the process of going through that is very similar to probably what a lot of people are used to in grade school. We put into a soundproof booth, we put on a set of headphones, raising your hand when you're hearing a beep, but there are a little bit more intricate details involved. We're testing how the patient is understanding words, how they're comprehending, really testing once it gets beyond that ear, what's happening in the brain and how the brain is understanding and interpreting as well. So,
and obviously there are going to be different levels and different severeness of hearing loss. So how is it that you go about treating this depending on that?
Yeah, so depending on the severity, and a lot of patients think that hearing loss is an all or nothing, which is why a lot of people tend to not really recognize it until it gets to be pretty significantly impacting their life. So once we diagnose that there is a hearing loss, what the process would be is really to come in and sit down with one of the doctors of audiology and discuss what's available as far as hearing devices, if that's an appropriate course of treatment. So with those hearing devices, they can range in size and style and color, in technology level. Some patients that need more challenging listening situations need a device that's a little bit more sophisticated. Other patients that really lead a quieter lifestyle may need something that's a little bit more simple and not as complex. So what we would do is really talk to the patient, discuss with them what their lifestyle is, and really find what fits best for them.
Can we tell our viewers today some tips that they can do daily to try to protect hearing loss?
Yeah, a lot of people don't even recognize that there's things in our everyday life that are probably affecting or possibly damaging our hearing. Some simple things, just by wearing noise protection when you're out mowing the lawn, using power tools, working with anything that could be exposed to that loud noises for a long period of time. Any kind of ear protection is really good. in those types of situations. My general rule is intensity versus duration. So if you're going to be in something for a long period of time, then making sure you're turning the volume down or trying to protect yourself in that situation is always going to be better. If it's a short period of time, you're on the treadmill for 30 minutes, you're working out, and you have a pair of earbuds in, and it's 35 minutes to a half an hour or 45 minutes, then cranking up the volume isn't going to really kill you. But
sure.
just kind of remembering that longer periods of time, make sure you turn that volume down, or get yourself something that's going to be able to protect your hearing.
Okay, definitely pay attention to it, think about it.
Right.
And then if something seems to be bothering you, like you said, if someone's urging you, come in and see somebody. Ohio ENT and allergy physicians, all the contact info is up on screen. Thanks again.
Thank you for having again.